Welcome everyone to Let's Chat COVID-19. I am your host Abdul Khwaja, and just before we start, just a few housekeeping. We have a team of moderators that are going to be scanning the chat just in case there's someone that's being a bit rude, a bit unhelpful. They'll give you a little warning just to let you know that it's not going on, and if you carry on, we're going to completely remove you from the chat. We have a team of clinical staff that are going to help you with your questions, and I'm going to introduce Dr. Asif Ali, Dr. Priya Kumar, and Dr. Sarah Bellards. But if for any reason we have any technical difficulties or your question does not get answered, you can get to us at eastberksccg.inquiries@nhs.net by Monday the 7th of February, so hopefully we can get to everyone's questions. So we got Dr. Priya Kumar. If you could give a little insight of how you got to where you are today.
Thanks, Abdul. So I'm Dr. Kumar. I'm a GP in Kumar Medical Centre. I'm the Health Inequalities Lead for Slough. And I actually come from a family of doctors, and through my upbringing, I saw what they brought to the community, what the community brought back to them. And I've always really wanted to be a doctor to serve the communities. I've enjoyed being a doctor for the last 8 to 10 years in Slough, and look forward to helping our communities in the future.
Oh, wow. And Dr. Ali, yourself?
Thanks, Abdul. Yeah, I'm actually my 20th year now as a doctor.
Oh, congratulations.
So, yeah, thank you. Graduated from Guy's and St Thomas's in London.
Wow.
I'm actually the first doctor in my family. My dad's a taxi driver. And I remember doing well at chemistry at school in my GCSEs, and my dad saying, well, do you want to think about doing medicine? And I haven't really looked back, so it's the most amazing career. I think one of the reasons I'm so passionate about general practice is to give out the right information to our patients, and children especially, because I'm a father of 5 children. I'm also a foster carer in Slough, so care of children is my utmost priority. Absolutely love paediatrics. If I didn't be a GP, I would have done paediatrics. So one of the main things I want to do tonight is really talk to the young people out there in Slough and answer their questions, and make them understand about COVID vaccinations and why it's the right thing to do.
I believe we have a lot of young people on the actual chat, probably on the fence whether to get the vaccination or not. So I believe that they will really appreciate a little insight of COVID and vaccinations. And we have Sarah Bellards, who's the Director and COVID Vaccination Programs Lead, who will give us a little insight of how she got to the position that she is in today.
Thanks, Abdul. I'm Sarah, as you said, and I'm the Director of Quality and Nursing for Fertility CCG. And I'm just going to upstage Asif about how many years I've been doing it. This is my 30th year of being qualified as a nurse to do that. And I've spent at least 20 years of my career working within infection prevention and control. So obviously I have a real interest in preventing infectious diseases in the population. So that's kind of how I've ended up with the COVID vaccine programme. I also strongly believe in vaccination, and I've encouraged my own children to take up the vaccine.
Wow, so we've got a really strong clinical team on our hands to answer all the questions. And the first questions we got already in. One question would be, are the vaccines safe for children? Wow. Dr. Asif Ali, would you like to comment?
Yeah, well, it's a common question that lots of my patients have asked, and because I'm in the community, I get asked that many times. Let me just answer that by saying I think we need to understand how vaccines work first,
right,
to understand then about the safety of vaccines. With the COVID vaccines, they work in about 3 essential ways, and each way is really to encourage the body to mount an immune response so that you develop immunity within your bloodstream, what we call antibodies. So when you do then get the virus, your body is protected with antibodies that reduce the severity of the illness or also protect you from becoming unwell. In terms of then the vaccine safety, lots of people were surprised how quickly the vaccines were produced. Historically, vaccines took decades to make. One of the things that we know with the BioNTech Pfizer vaccine, for example, there was concerted effort from drug companies and also governments around the world, because it was such a lethal virus. We all have a very short-term memory, but let us go back to when the pandemic started around the early part of 2020. We had huge amount of fatalities and hospitalizations across Europe. At that time, the vaccine effort started, and I think we're very fortunate that we have such fantastic vaccines. The vaccines throughout their development have gone through a whole regulated process of production, and absolutely no corner has been cut in producing those vaccines. Each country also has a regulator, so we're very fortunate in the UK to have the Medical Health Regulatory Agency, the MHRA, and they reviewed all the evidence. So initially they did that for adults, and they looked at all the evidence for adults, and more recently they've done that also for children, when they granted emergency use for children as well.
So what would initially take 10 years for development was sped up to a year and a half?
It was accelerated, and the reason it was accelerated because the need was there.
Yeah.
The need was there, and I think the public would have faced a completely different outcome if vaccines did not come on board. We're very fortunate. As you can see from this winter, if you compare it to last winter, the number of fatalities is significantly down, and that's completely down to vaccinations. What we know, even in children, for example, those children that aren't vaccinated tend to get a lot more sicker and end up in hospital. Even though that's not common, it can happen. And one of the reasons why I believe children should get vaccinated is because it offers them that protection. In terms of safety, though, lots of people don't want to be first. Lots of people wait for others to have it. But right now, 1.9 million people, children, have had the vaccine. And there's very, very few reports of anything significant. In addition, there's been lots of research and follow-up studies. For example, there was a study published in America just this month where they took over 2,000 patients and they followed them through to see how the vaccine affected them, and it showed the vaccine was safe and also mounted a really good immune response, produced more than 90% effectiveness. So the vaccine is safe, it can be given in children, it's gone through all the regulatory checks. We wouldn't be sitting here tonight, and I wouldn't be sitting in my surgery telling parents and children to get vaccinated if I thought the safety and evidence was not there. I'm a father of 5, just like
many people watching tonight.
Many people watching, and also the panel. I've got a 12-year-old, a 14-year-old, and I got both of them vaccinated in October, and they've had their second dose as well now. And that was purely because I wanted to protect them against the coronavirus and the severity of it.
Right. A leading question from that, a lot of parents question, what is the point of getting my child vaccinated if they've had COVID, they caught it, should they not have that natural immunity? Dr. Kumar, would you like to comment on that?
So what the evidence has shown is that our children and young people, about 50 to 80%, have actually caught the coronavirus.
Right.
However, we do know with natural immunity, upon recovery, it only lasts up to 6 months. So actually, we know with the vaccination that it would basically build a better response if, for any reason, they were to get COVID again. And furthermore, we don't actually know the effects of COVID with regards to the Omicron, and that hasn't actually been determined as yet. And we don't know what more variants will be coming as the years pass. Therefore, we need to protect our children as much as possible. And as Dr. Ali said, we know that children have mild symptoms, but we do know that some get serious symptoms, and that vaccinations do make a big difference.
Would you also say prevention of spreading it to others as well? So others, children, other vulnerable people that they may live with?
Absolutely. The vaccine has shown that it reduces the chances of passing on the virus to people that are in close contact with your children within the actual household. And furthermore, we do know that 1.3 million people are living with the long COVID of the 6th of December this year, and last year, sorry. And actually, we know that the COVID vaccine reduces the worsening effects of the long COVID, whether that's tiredness and weakness. And we know that's the same for children as in for adults. So we have a greater responsibility to give our children the best possible chance against COVID-19.
So we all know about the benefits of COVID. The COVID vaccination prevents you from getting COVID. But what about the long-term side effects, the negative side effects from getting the vaccination, Dr. Ali?
So I think it's interesting that right now the spotlight is on COVID vaccine, but any medication that patients take, if you open the box and read the leaflet inside, there's a whole list of side effects listed. Does not mean that when you take paracetamol you're going to get liver failure, but it's reported as a potential side effect. We take paracetamol without even thinking twice that one of the consequences could be liver failure, but that is very, very, very rare. I think what's happened with the spotlight on COVID vaccine is, unfortunately, lots of people have focused on very, very rare effects that have been picked up through populations. When you have the vaccine initially, as I said earlier, the body will mount an immune response to produce antibodies to fight against infection. One of the things that may happen in the first day or two, you may become slightly unwell, but not significant. So, for example, about 50% get a dull ache in their arm where the vaccination went. That tends to go completely. You may get a body ache, you may get a mild fever, you may get a headache. But as we know, in our experience with adults tend to get better within a day or two with paracetamol. We know children, I certainly know in my family anyway, my children generally bounce back pretty quick. The adults tend to get symptoms a bit longer. Children generally don't get affected significantly with side effects, but they may get some of these mild effects. You certainly are not going to get COVID from a vaccine, but your body thinks that it's got the coronavirus inside, and that's why it's producing the immune response. So by and large, as I said earlier, the vaccine is very safe. The side effects are very minimal. I think what we ask parents to do, and also children, is to balance the risk versus benefits. I think Dr. Kumar's mentioned about the benefits of getting vaccine. It's about reducing hospitalizations. It's about reducing severity of illness. It's about protecting your loved ones, especially those that are immunocompromised. Also, children who are in at-risk conditions, they have significant medical conditions that put them at high risk. Vaccination is very important. There's two very rare symptoms that and consequences of the vaccine. Dr. Kumar mentioned long COVID syndrome. There's also a multi-system inflammatory response that can happen to coronavirus. And just like stories where we've had adults in their 20s, 30s, 40s sadly pass away with COVID, we don't really have a huge amount of evidence or even ideas of which children will get severely unwell. And because we're in such an unknown, my advice to my community, the patients that I serve, is play it safe, get vaccinated. The side effects are very rare. Even the effects that I've mentioned only last a day or two, but then you get long-standing protection. We know when you get your first dose and you repeat it after 12 weeks, you are likely to get protected for at least 6 months, okay? And then that will get you through over this significant risky period, especially over these winter months.
Wow, perfect. So we had a few parents actually email us before this live session even started saying, my child won't take the vaccine. I've consented to it. I really want them to get the vaccination. But when it comes to it, they're too scared to actually get the vaccine. Sarah, what could the parents do to help the children over this period?
So our teams that are going into the schools are really experienced of giving vaccines to children, and generally they will be able to help and support the child to have the vaccine in the school. If your child comes back not having had the vaccine because they were unable to for whatever reason, our centres are really used to giving the vaccine to children as well, and you can go to any of the centres and they'll give it to your child. I think we've got the link up to where the centres are open and how you can go and you can walk in. I think our two centres in Slough have given more than 265,000 vaccines during the time period that we've been giving them. So you can see they're really experienced in doing this, and that's just in Slough.
So if at any point that you want to book your COVID vaccination, there should be a PIN comment up here that you can just click to straight away. And on the in the description, there will also be a link that will give you access to book your COVID test as well. One of the biggest myths I've actually heard about COVID is that if my child gets the vaccine, it could decrease the fertility. Dr. Kumar, would you like to comment on that one?
Absolutely. So this is a myth. There's no evidence that supports that the COVID-19 vaccine affects fertility. Animal studies done by Medina and Pfizer showed no effect on rat infertility in any way or form. Over 100,000 women in the UK and Scotland have actually had the COVID-19 vaccine, and there has been no impact on their fertility from date of what we've seen. Personally, I've been pregnant in the last year. If I had the opportunity at the time to have the COVID vaccine, I would have. But as soon as I could have the vaccine, I was breastfeeding and I happily took it. And it was to protect me, my family, from the spread of infection. And also, we do know that with regard to pregnant women themselves, it's really important to get the vaccine because they can get some serious illnesses and end up in ITU for those that are unvaccinated. And therefore, this is an important point. If you are pregnant with children in your house, it is important to get your children vaccinated to protect yourself and your future children as well. And if you wanted any more information about fertility and the COVID-19 vaccine, there's the British Fertility Society that you can go to, and we can ping that in the chat as well.
Amazing, perfect. Living in Slough, we have a lot of multi-faith backgrounds that have specific dietary requirements. One of the biggest fears is, does this COVID vaccine contain something that is forbidden in my faith or religion? Dr. Ali, could you give us a little insight of what's actually in the vaccines, and would it be harmful for other patients, in a specific background or faith to have?
Yeah, I was actually talking to my son yesterday. He's 12, and he was telling me some of his friends have said there's monkey in the vaccine, and I think that myth started obviously from the AZ vaccine because. Right. You may know or you may not know, it's a viral vector vaccine where you take an adenovirus that infects chimpanzees. Right. And the coronavirus itself is carried by that adenovirus into the bloodstream and then causes the immune response. Now, early on in the vaccine production, people spread a myth that you were injecting chimpanzees. So being somebody from a faith background who we obviously don't want animal products injected into us if we can avoid it. People were really worried about it, but clearly it's a complete myth. And I think I reassured my son to tell his friends that there's absolutely no chimpanzee in the vaccine. The other thing people obviously worry about is pork, alcohol. Yeah. There was reports that there was those sort of animal products. Let me just be clear, there's absolutely no animal product in the vaccine. The vaccine is halal for the Muslim community that are listening. Vaccine is halal for you to use. There's absolutely no issue. There's no Islamic reason for you not to have the vaccine. There's no alcohol in this vaccine that is going to cause any major issues. Of course, alcohol is present in very, very tiny quantities. So, for example, in the AZ vaccine, you'd probably get the same amount of alcohol you'd probably get in a fruit, like a grape or something. That's the level we're talking about. So don't just download the list of the internet and say, oh, it's got formaldehyde or mercury or alcohol. You've got to get into the detail. The detail tells you that it's a very safe vaccine. Me myself, I've had 3 doses. All my family have had 3 doses. My children have had 2 doses. And there's been absolutely no issues. And we know that from the millions of doses of vaccine given in this country. I think we're over 50 million, aren't we? In this country in first and second. Oh, wow. Well, now, if you add the totality, right, we are way over. Probably heading towards 100 million. I.e., we're not talking about 1 or 2 people. We're talking about millions of people have been vaccinated. And there's a huge wealth of evidence now that it's a safe vaccine. Those people that were reluctant to have the vaccine go back like 14 months ago, when it first came out, I could understand the anxieties and fears. We've got 14 months of experience. We know the vaccine's safe. We know it reduces hospitalizations. One of the reasons we've got through this winter with very little changes in people's there was no lockdown, was there? So people could walk, move around and do everything they wanted to do. And one of the reasons was the vaccine. Without the vaccine, you wouldn't have had the protection that we afforded. And therefore, those small number of you that haven't been vaccinated, I think you just need to think again. What is the reason you're not getting vaccinated? Are you still holding on to those myths that were said more than 15 months ago, that this has got chimpanzee in, or this has got pork in, or this has got microchips in that's going to monitor where we're going? I mean,
I guess that's the whole substance of this talk. Just trying to break the myths, trying to clear the information with the most accurate information that we have.
Yeah. And I suppose people will be thinking, I'm sitting here as a doctor, I'm going to say,
you're just going to tick all the boxes that you're meant to
say the vaccine, but I can tell you now, I'm not that type of doctor. I always look into the detail of doing something, and I'll only do something if I really believe in it. And one of the reasons why, even last year, I was advising adults to have the vaccine was because of all the deaths that we were seeing amongst the community. I mean,
personally, you will see.
Personally, but also coming from a Pakistani background, and I have lots of patients from the BME community, I was seeing the consequences of this infection. And what we know, in the very small cases, children can also become unwell. But let's not remember, children live with their elderly grandparents, with their parents who have illnesses as well. And if children are not vaccinated, they are likely to bring those infections home, and they could cause serious illness in their grandparents and their parents.
All right, perfect. Questions are already rolling in. Wow, that's amazing. Got quite a few questions. One question, does the vaccine actually protect against Omicron? And is there a better vaccine over another vaccine? Sarah, would you care to comment?
I'll probably get Asif to help me with this one.
I mean, the initial evidence that came out with Pfizer and AZ was against the Delta variant, wasn't it?
Yes,
that was a predominant variant at the time, and the effectiveness we know was more than 90%. And a lot of the evidence has been that. But let's take Omicron. Well, we know obviously Omicron is a mutant. It's a change in the spike protein due to a change in the genetic code. What we know with lots of viruses, for example, influenza as well, is a virus that we've had for years and years and years. Vaccines have to change in time because the virus will change.
So we have to basically keep up with the actual change in variants.
And so the way I would approach it in a very pragmatic way. We are where we are right now in terms of the variant. Omicron is a variant we have now. Give it another 6 to 12 months, we may have a different variant. And that is likely to happen, okay? But the advice is to take the vaccine that is available at that time. And the reason being, even if you do not get the full protection that we found with Delta, what we do know from evidence is that it significantly reduces the hospitalizations and severity of illness. And we know with Omicron, it also reduces transmissibility, which means spread from person to person. So I think that's one of the other reasons why I think you should get the vaccine done, irrespective of the variant.
Wow, perfect. And another question came through by text message, so not even just by live chat, by text message. Is there a link between type 1 diabetes and coronavirus? Is there something that triggers your diabetes if you have a lower immune system or if you get COVID? Dr. Kumar?
I haven't seen any evidence that links type 1 diabetes to the coronavirus, but what we do know that it is important for people with type 1 diabetes to get the COVID-19 vaccine to protect themselves, because we know that they are more vulnerable to serious complications, and that's just the nature of the disease with diabetes. So they're one of our top vulnerable groups that we do want to reach out to. that if you are a type 1 diabetic, come back and get vaccinated. And if you've got a child in your house and you are a type 1 diabetic, it's really important to get them vaccinated to protect them and yourselves. As Dr. Ali has said, it's about reducing the passing on of the virus, which is the key here in many households. As we know, we live in multi-generational households in Slough. It's really important to protect our whole household as much as possible.
I was just going to make a general point about causality. Because we've injected millions and millions of people, illnesses will come and go, and the incidence of illnesses, as we know, will occur. What is tending to happen, and I've noticed this a lot with people who've had the first dose and then decided not to have the second dose, is that they've said, I've had the first dose, but after this period of time, I've developed this symptom or this condition. And they're trying to attribute that with the first dose. But the reality is there's absolutely no link between the vaccine and a condition like diabetes or any other condition. Conditions will occur at the normal incidence rate that we see. And because the vaccine is so common, is so commonly given, causality is not proven. And so there's absolutely no link at all with any type 1 condition. And I suppose the person asking the question may be worried about autoimmune conditions, because we know type 1 diabetes is a antibody against the pancreatic cells. But there's absolutely no evidence that the vaccine produces any antibodies that mimic anything to do with pancreatic antibodies.
Right, perfect.
What we do know, though, is the second dose does improve your immunity against COVID-19. Not just having your first dose, it is an enhancement by having the second dose. So you're further protecting yourself.
That was leading to the next question: is 2 doses or even a booster necessary for everyone to get? That's an open question to anyone that wants to answer.
Well, we know from evidence that the first dose gave around 70-75% protection, and it was after the second dose we got the enhanced protection. Now, the reason for the booster is we know that after a period of 6 months, immunity tends to wane, and therefore the booster dose is needed to improve immunity. One of the common questions that patients ask us is that if I've had the first dose and then I get COVID-19, is there any point in me getting a vaccine? That's a very common question I get asked, and I think that's linked to that question as well. What we know is that from a vaccine you get immunity because you get antibodies. When you get COVID-19, you also get some immunity, but we also know even after natural infection, your immunity will decline as well, and therefore it's still recommended that after a period of 12 weeks that you should still have your second dose, especially for children.
Right. Okay. So let's say I've had my first dose, then I get COVID. How long do I have to wait, or do I even need to get my second vaccine?
I think I just answered that to say that you have to wait 28 days after. You have to wait at least 28 days after becoming unwell. But remember, the dose interval is if we're focusing purely on children tonight, and I don't want to complicate things, is that for children, the advice is then obviously to wait 12 weeks from the first dose, but you have to wait at least 28 days from your last infection.
Right.
So if you were to get COVID, just as you came up to that 12 weeks, you would still have to wait for 28 days after that.
Right. Perfect. And are children being admitted into hospital with COVID? Do we know that statistical figure if children are being admitted into hospital?
Well, what we know is from, we don't have local data, but we do know from national data that, for example, the week leading up to Christmas, up to Boxing Day, over 500 children got admitted into hospital, and half of those were in the 5 to 11 group. And that's more than double what was happening in November, for example. So it's a very real thing that people are becoming unwell with it. Now, we don't wish that upon anyone, and although the numbers are small, it can still happen. And as I said earlier, there's absolutely no way of knowing if that's going to be your child or not. Yeah, I'm a parent of 5. There's absolutely no way I would know that if my daughter, for example, who has asthma, if she's going to get COVID and get severely unwell. And so therefore we've decided to vaccinate her, and that's why she got vaccinated. And throughout the winter she's stayed pretty well, and I'm happy we've got her vaccinated. And that's the message I give to my patients as well, and parents that ask me, is that the best thing that you can do to protect your children is to get them vaccinated.
And let's say hypothetically I was pregnant, right? And I get COVID. What are the major risks of to me and the child if I was to get COVID, Dr. Kumar?
So if you're vaccinated,
Let's say you're
unvaccinated. So if you're unvaccinated, we know that pregnant women are more likely to end up in ITU, which is intensive care unit. We know the reactions of COVID are much worse in unvaccinated pregnant women compared to vaccinated pregnant women. There's been little effects on the baby that we have seen, but obviously your immune system is low when you are pregnant, and if you get COVID, we do know that women end up in the mother is much more seriously affected. Whereas with women that have been vaccinated, there's been less ITU admissions, there's been less severe effects, and actually they're able to ride out the infection just like anyone who wasn't pregnant.
And previously you mentioned that it's completely safe to get vaccinated while pregnant.
Yeah, absolutely.
Right, or breastfeeding.
And Dr. Keema, isn't it true also that pregnant women that acquire COVID that are unvaccinated are at an increased risk of having a preterm baby, which obviously has the risk to the baby in that way?
Yeah. Sorry, yes, Sarah, I forgot about that. Absolutely. So if you're unvaccinated, you're more likely to deliver your baby early if you actually contract COVID.
Just a quick reminder to everyone that's watching, we're here for another 15 minutes, so if you would like to book your vaccinations, please call us now, and we can get you just get you booked up. And we hear a lot about long COVID. What is long COVID, and what does that even mean, long COVID?
So COVID obviously is the acute infection, and lots of people have it for a number of weeks and then get better. Long COVID is when the symptoms persist beyond 3 months.
Right.
Okay, and what we know, for example...
Do we know what the symptoms are?
Yes, yeah. So generally those symptoms are a syndrome. So we call it a long COVID syndrome, and it's a syndrome of symptoms, and that varies. So some patients, for example, can feel very tired. Some patients can get very short of breath still.
Mm-hmm.
They can get headache, for example, and musculoskeletal symptoms.
Sounds like me walking up the stairs already.
So what we know, I'm in my 40s, and sometimes after a long day at work I feel like that. But what you don't want is children who are normally energetic, running around, doing all the things that they want to do, like sports, football, all the other activities that they do. You really don't want children getting long COVID, because that reduces their life chances and their educational potential. Long COVID, unfortunately, has been found in about 1 in 7 children who get COVID. It's a real problem, and we're only seeing lots of those cases emerging now. And the problem with long COVID is children are likely to feel unwell for prolonged periods of time. And what it means is that children can't go to school like they want to. They can't do the activities they want to, and it will over time affect their academic potential. And therefore the best way to try and reduce long COVID is to get vaccinated. And what we know through vaccinations is that the severity of the illness is less. I haven't seen any head-to-head data as yet between vaccinated versus unvaccinated in children long COVID, but the science tells me that the vaccinated group are likely to have lower severity of illness, and therefore that should translate into lower numbers of long COVID.
So we have one question from a parent. If I forget to return my child's consent form to get the vaccination while they go to school, can they still get it that day? Have they missed their slot? Do they have to rebook?
We do need consent in
Yeah.
order for them to have it. But as I said before, if they want to go and get their vaccine from any of the vaccine centres, which is pinned on the chat, on the top bar, they can just go along and do that. So, you know, these things happen. We all miss things, don't we? You know, as parents, you know, with school letters and stuff, they pass us by, especially if we're working and whatever. So, you know, it's not, you haven't missed your opportunity. You just need to go along to one of the vaccine centres and you can get your vaccine there.
And it's quite amazing how many vaccine centres just popped up, and there were so many people vaccinating. Who are these vaccinators trained? Were they all nurses or?
So we're using a wide range of staff in the vaccine centres. They've all been trained to draw up and give the vaccines and understand what to do, you know, who to give it to, who not to give it to. It's all very safe. We use all sorts of clinicians, registered clinicians. We've used nurses, doctors, physios, paramedics. It's been a real multidisciplinary effort, and it's been amazing how many people have stepped forward and wanted to do that. So many retired clinicians, doctors and nurses, etc., have come forward to do it.
Just want to be a part of the change, right?
Yeah, because it's just such an amazing program to make. You know, it's making such a difference to so many people's lives. You know, I think at the beginning of the program, when we did the first people, the absolute gratitude and the relief for people, you know, especially our elderly population that have been sort of chained up, if you like, in the homes due to lockdowns and things for a very long period of time, being able to get out and feel safe again for the first time was amazing.
Yeah. And Patrick on YouTube has asked, do we have the national stats of children who have been vaccinated?
I think I mentioned that earlier. Patrick may have missed it. It was 1.9 million.
1.9 million
doses have been administered nationally. But what we know across the world, though, UK is obviously not on its own here. We know the United States are ahead of the game in vaccinating children.
Is that percentage-wise, I'm assuming?
Yeah, so I don't know the exact numbers from the US, but there's, as I mentioned earlier, there was a study in the New England Journal of Medicine that suggested about the safety and efficacy of the vaccine in children. We know from lots of US data that the vaccine is safe in children.
Mm-hmm.
And as I said earlier, people were worried about giving vaccines in children at the start of the school year. But what we know now, 4 to 5 months on, 1.9 million children have been vaccinated in the UK, alongside millions of adults. There's no reason why this vaccine would work differently in adults compared to children. Clearly in children we vary the dose, but that's our prerogative as clinicians to make sure that we give the right vaccine with the right dose. As Sarah mentioned earlier, lots of the vaccine sites, and one of the leads of the Langley site, all the staff go through a rigorous process of training. We make sure that they have all the theory and all the different issues around vaccine storage, mixing, how to administer, making sure all that quality assurance checks are done. Because what we want is when patients, parents and children come into the vaccine site, that they get a really safe and good experience. We know some children can be fearful of getting an injection. Mm-hmm. I remember my daughter, when I had to get her vaccinated for holiday a couple of years ago, she wouldn't come forward and get vaccinated, and I had to come up with this game for her just to convince her to get vaccinated. I know lots of parents are going to be worried about getting children vaccinated, but we're well used to having these types of children in our surgeries, and we will look after them so well, and if need be, take them into a separate room and make the environment really nice for them to get vaccinated. We just need parents and children to come forward. Right. All vaccine sites are all set up now to get vaccinated, certainly in Slough.
So the media has been quite tough about the negative side effects of the COVID vaccination. I have a question here on YouTube saying, is the vaccine safe for patients that have narrowing of the arteries or have any heart muscle weakness?
Well, unfortunately, I'm not going to hit the newspaper headlines if I say the vaccine's safe.
Yeah.
And as I said to you earlier, I don't know the figure, but it must be approaching 100 million of doses given, because the population of the UK is more than 55 million, so loads of people have been vaccinated twice. And earlier I mentioned about causality and proving that a vaccine causes a particular symptom or condition. What we know from data that we've collated, and just to backtrack a little, when a new drug is introduced into the UK, we have something called the yellow card scheme, which is a really effective way of regulators to pick up on serious effects. And one of the ways we do that is people fill out these notifications, so they get pulled across the country. And what we know is that it certainly does not cause any narrowing of arteries. There was, of course, concern with the AZ vaccine last year around thrombosis risk in patients who are under the age of 40. And if you remember, the UK changed its guidance, and young people and people under 40 were vaccinated with Pfizer. And so the only vaccine we're offering at the moment locally for children is Pfizer. And we know from evidence that it's safe and doesn't cause any of these serious side effects.
And going on to children, will there be any introduction to get patients or children under the age of 9 for them to get vaccinated? Sorry. Sarah, do you have any information on that?
So we're currently vaccinating children between 5 and 11. They're extremely clinically vulnerable, and those families will be being contacted to ask them to come forward to have that vaccination, or if they're in the household with somebody that's immunocompromised. So those families are being approached. The recommendation about the rest of 5 to 11-year-olds hasn't come out yet from JCVI. They're currently considering that at the moment, and we will act on that when that advice comes out from JCVI.
Amazing. And another question I have right here, is there any specific combination which is best? So if I was to get Pfizer, AstraZeneca next, or Moderna, then Pfizer, is it any, because some of the vaccinations work in different ways. How do I know that if I should get 3 Pfizers, should I get 2 Modernas and Pfizer? What's the best combination, or is it all completely fine to take?
I'm not aware of any head-to-head. I'm not aware of any head-to-head data with vaccine combinations. As I said earlier, AZ isn't given in children,
right,
and so the option is pretty much Pfizer. Pfizer has the longest evidence. It's been around longest. It's been here 15 months. We've vaccinated millions of adults, and now 1.9 million children. We know the US have used Pfizer extensively, and therefore my advice to my patients is to go with what's tried and tested, and that's Pfizer.
Perfect. So for children is basically just Pfizer.
Yeah.
And then anyone that's not a child or a young adult or even in the older generation.
So generally, the vaccines, I wouldn't advise patients to start picking and choosing vaccines. The reality is all the vaccines, and you're probably asking me about adults, are you?
Just a general ballpark.
Yeah.
I believe.
So
yeah.
I mean, Pfizer's only available in children.
Mm-hmm.
Adults locally is pretty much Pfizer.
Yeah.
But generally, it's not like you can pick and choose that I want this vaccine or this vaccine.
You probably had patients that have been strongly advised, only have Pfizer, or only have AstraZeneca. You probably had a lot of patients that says that I only want this, right?
Yeah. So in those situations, for example, around Pfizer or Moderna, we have been able to, for specific clinical reasons. So, for example, somebody may have a significant reaction to the first dose of Pfizer, for example, or an ingredient within Pfizer, but that is exceptionally rare. And we would have that one-to-one conversation
and that would be
with the patient.
The time you would advise them not to have that, I believe.
Yeah.
Well, we'd advise them to have a different one.
Yeah.
We'd put them through that clinical advice, and then we'd offer them a different vaccine if it was appropriate. I think the other thing we really wanted to say, Abdul, to people is that it's not doesn't matter, we really are promoting it for children today, but it doesn't matter. If you're someone that hasn't had your first or your second vaccine, we'd really welcome you to come and take up your vaccine. It doesn't matter what your reasons are for having not had it yet. They're your reasons. All we want to do is give it to you. We won't be asking you, why haven't you had it yet? If you change your mind and you've decided you want to have it now, please do come forwards and we'll give you your vaccines.
Perfect. I believe we are just out of time. So if there are any unanswered questions, please feel free to email us at eastberksccg.inquiries@nhs.net and we'll try to get your questions answered. This is also being recorded, so we'll have short clips that are going to be uploaded. So if you missed any of this, or if you want to come back to it, just to get more information, that will also be available. If you want to talk to a member of our panel, they all speak, not all speak, but we have members that speak Punjabi and Hindi, so you can call them at 0753 401 8714, which that is 0753 401 8714, and our panel will be here for an extra 15 minutes to answer any additional questions. But thank you, everyone, and thank you, panels, Dr. Priya Kumar, Dr. Asif Ali, and Sarah Belaz, for coming here and just sharing your vast information and your experiences with COVID-19 and vaccinations. I've been your host, Abdul, and thank you so much.